before going into my room, I'm going to make sure that I have an order for tracheostomy suctioning. I will knock on the door. I will open the door. I am acknowledging my patient. I'm watching for safety. I'm going to make sure that I use standard precautions and proper body mechanics. I'm going to identify my patient. I'm going to perform hand hygiene as soon as I walk into the room. Hello, Miss Tracy. Can you please tell me your name and date of birth? Tracy Trake. Okay, I'm also checking her allergies. And I'm gonna introduce myself. Hi, my name is Hefzi, and I will be your student nurse. At this moment, I will explain to my patient the procedure, how long it's gonna be the procedure, answer any questions she has. And also I'm gonna set up a stop signal in case she needs me to stop at any time during the procedure. I will need my suction catheter kit, and I'm gonna make sure that I check the integrity of my packages and the expiration date before I open any package. I'm gonna check it. I'm gonna also need a saline. I'm gonna use some PPE, which is a mask and a eye protector. I'm also gonna need a waterproof pad for my patient. I'm gonna put down this side rail because I'm gonna be working on my patient's right side since I am right-handed. And I'm gonna put on a waterproof pad on my patient. Are you having any pain, Miss Tracy? No? Okay. If she was having any pain, then I will assess for pain and come back in 30 minutes to make sure that she's out of pain. So I'm going to now assess my patient also before I put on the waterproof drape. I will check for crackles in the lungs. I'm also going to check the pulse oximetry. Okay, and she's good. Now I'm going to adjust my okay, and now I'm going to perform hand hygiene one more time. So for this procedure, I will be using a portable suctioning device. If I was using a wall suctioning, I will be setting up my millimeters of mercury to be 80 to 100. But for this portable device, I will use 10 to 15 millimeters of mercury. Okay, so I will don one clean glove, and this is so that I could test my equipment. I'm gonna turn it on, and I'm testing it. Okay, it works just fine. And I'm gonna place this on the waterproof drape, and I'm gonna remove my glove, perform hand hygiene. Okay, for this procedure, you wanna make sure that your patient is in a semi-fowlish position, and also that your bed is up in a comfortable position for you to work on. Okay, this procedure is going to require you to put on a mask and some goggles or a complete face mask. Okay. For the purpose of this procedure, I will keep my mask up here, but let's pretend that I have the mask on. Okay. I will perform hand hygiene. And now I'm getting ready to open my sterile package. For like any package, you will also check the sterility. Not the sterility, making sure that your package is not wet or compromised or open, and the expiration date for all your supplies. So I will open my package using the proper technique. And the first thing that I'm going to remove is my small sterile container, and this should have been put in this way. That way I only touch the bottom of the container. Stay within my 1-inch border and place this at the end of the table closest to my patient. Next, I will pour my saline making sure that I check the expiration date and that the label is facing the palm of my hand. I'm going to touch only the lid when I'm opening. I'm going to pour.
So first thing I have to do is to check.
Close it. Put it away. And now I'm going to don my sterile gloves. And I'm going to make sure that I put on the time and date that it was opened and my initials. Okay, and I'm done in my sterile gloves.
So I'm now going to wash my hands. The patient shows. I'm not going to do this for the video. I've already suctioned my patient and the area is good. Now I'm going to wear my gloves and remove the sterile dressing.
Okay. And I put it on backwards.
Remove the sterile dressing on the side. I'm going to discard the gloves and the sterile dressing. And I'm going to perform hand hygiene. Now I'm going to start cleaning the disposable inner cannula for the tracheostomy.
I'm only touching the inside of the glove.
Check the trach care tray for the integrity of the package and the expiration date and the contents of the
Okay. Now I am going to get my suctioning catheter,
I'm going to open my
and I'm gonna wrap it around my dominant hand.
face the shiny side down.
And now I'm going to purposely contaminate my non-dominant hand
So now I'm
by grabbing in the suction device. The machine has been on this whole time. I'm gonna ask my patient to take, well, I'm gonna connect the two ports, making sure that I don't touch the contaminated part with my sterile glove. And then I will check that it is working.
So now I'm going to start
Okay, it is suctioning. I'm gonna ask my patient to take some deep breaths. I'm gonna hyper oxygenate my patient, and I'm gonna remove the mask. And now I'm gonna go in to the predetermined length, giving my thumb up. And once I'm in, as I'm going out, I'm gonna start suctioning. And I'm going to flush it. I will do this again. And I'm gonna do it for no more than 15 seconds. And I'm gonna wait 30 seconds between each flush. And I will only do it 3 times at a time, and no more than 5 minutes at a time. Flush this. Okay, and now we are done cleaning. I'm gonna also do my patient's mouth. And flush.
So now I'm going to perform hand hygiene and
So,
some facial show.
keep this in my glove. Put this back in here. The mask back on my patient.
So the area
And remove my glove with the catheter inside.
clean gloves and remove the sole
Dispose of it.
on the side.
Remove my other glove. Dispose of it as well.
To remove the
I am going to remove my mask.
So I removed it. I'm going to
Dispose.
discard the sole dressing and the
And I'm going to perform hand hygiene now because I just removed my gloves.
Now I'm going to start
And I'm going to provide oral care for my patient.
So next I'm going to check the integrity of the package of the tracheostomy.
I'm going to turn off my machine.
The expiration date, and I'm going to also check for the contents of this tray.
And I'm going to reassess my
Now
patient.
I'm going to open this tray.
going to check the pulse oximetry as well.
Now I'm going to open the tray.
Okay. And when my patient is good, we'll also throw this away.
This tray, this tray.
Okay, now that I removed my supplies from the patient, I am going to perform hand hygiene if I was wearing gloves. And just to end, I am going to thank my patient for letting me take care of them. Thank you, Miss Tracy. And I'm going to put you back in a comfortable position. I will lower the bed and I will make sure that you are comfortable. If you need anything else from me, there's water and your call light is right here. Would you like me to open the doors? I mean, not the doors, the curtains, or leave them closed? Okay, we can leave them closed today. Now, before I leave, I'm gonna make sure that I check the room for safety and that I go and document, gather all my supplies, leave the room, and perform hand hygiene before I leave. And I think that's it. I will go and do my documentation.